Lifting and carrying something incorrectly is one of the main causes of long-term sickness absence and injuries at work. Back problems account for 1/3 of work-related sickness absence. Just one small mistake in lifting something can cause an injury which could affect the rest of your life. It is therefore vital that whenever you lift, move, or carry anything, you are doing so safely. Some common situations for lifting will arise. If you're in one of our shops, you will move stock. If you're in mobility aids, you will move equipment. If you are in independent living, you may carry shopping, and if your role is in event first aid, you may move patients. However, all of us will have to move or carry at some time, whatever our role or wherever we are based. When lifting, you should always avoid bending from your back and keeping your legs straight. You are at risk of getting a back injury if you do. When lifting, you should always ensure that you can see over the top of what you're lifting. However light the object might be, you should always be able to see over it. What are the key things you've identified here? You should always ensure the following. Your feet are shoulder width apart. You should have one foot in front of the other so that you have a stable base. You should bend from the knees. Before picking the object up entirely, you should ensure that it is not going to be too heavy for you, thinking about how far you must carry it as well. Do you need to negotiate stairs or changes in floor level? When lifting it, you should do so slowly, ensuring that your hands are either side of it so it is supported. Is there anything about the load that could make its weight shift without warning? Liquids in bottles can be tricky. A few loose items in a large box could shift easily. Does the load have any sharp edges, protruding parts, for example nails, or weak handles? Is it wet or otherwise slippery? When you have to lift or move an object, it may be useful to think about the acronym TILE. TILE stands for the following. T, task. You need to spend the time thinking about this. What is it you have to move? Will you need to hold the object away from the body? Can you think of any additional risks? If you have any concerns at all, you should speak to your manager or team leader. I, individual. Are you, the individual, moving the object sufficiently trained to do so? This training is at the first level, but to move some equipment or move people, you require more training. L. This is for the load being moved. As I mentioned previously, you should check to ensure it is not too heavy. If you think it may be, then ask for help. A fit adult should be able to comfortably lift and carry 20 kilograms held close to the body. E. This is for environment. Before moving anything, check the room you are in. Is the floor clear or slippery with water? Is there room to move the object? Is there sufficient lighting? It is important that you check these before moving an object. E. Equipment. Do you need any equipment to help you move the object? If you do, have you got the equipment? Is it in a good working order, and have you been trained to use it? Does the weight or size mean you need help from another person? When moving anything, however small or light it may be, it is important you follow these guidelines. Injuries don't just happen through moving heavy objects. You should ensure that you are not putting yourself at risk of injury at any time. If in doubt, ask for help before attempting to move or lift the object.